Hollyn Cetrone, Northwestern University. She is speaking on participatory agroecological intervention decreases depression among female smallholder farmers in Singida in Tanzania. Thank you. Please over to Hollyn.
Hello, everyone. Again, my name is Hollyn, and I actually just graduated from undergraduate at Northwestern 2 days ago. So be nice to me, please. And so I've been working with Dr. Sarah Young in the audience and with Dr. Marianne Santoso sitting next to me looking at how a participatory agroecological intervention has been shown to decrease depression amongst female smallholder farmers in Singida, Tanzania. And so I want to start off by talking about how important mental health is and how prevalent depressive disorders are in today's world. As you can see, depressive disorders are leading causes around the world of YLDs, or years lived with disability. So the issue is prevalent. And two important takeaways from this is that 80% of the years lived with disabilities from depressive disorders are occurring in low and middle income countries. Additionally, women are affected by depressive disorders consistently at higher rates than men are. And so then, why am I here at the Agriculture, Nutrition, and Health Academy conference talking about mental health? I'd like to argue that mental health actually underpins all three of these categories. First, agriculture and nutrition are factors which can affect mental health, and then in turn, mental health status is something that can affect women's and child's health down the line. Furthermore, this is a bidirectional relationship since mental health status can affect agricultural yields and nutrition intake the other direction. But what I'm mostly interested in today is seeing how a nutrition intervention can affect agriculture, nutrition, and in turn, mental health status down the line. And specifically, I'm interested in women's depression. And previous studies have shown that food security is the way that nutrition interventions can impact mental health. And I can summarize this relationship, how food security fits within this pathway, in 4 points. First, not having access to food can create stress for someone. Additionally, especially for mothers, not being able to fulfill their social role of providing food for the house can be stigmatizing and stressful. Food security is associated with poor economic status, which is also stressful. And finally, not having access to nutritious foods consistently can result in deficiencies, nutritional deficiencies, which are associated with poor mental health status. And so now here I am showing you results how a specific nutrition and agriculture project, SNAP-TZ, was able to decrease women's risk of depression. And I will come back to these results later, but I just wanted to introduce to you now the idea that an agriculture and nutrition intervention can impact mental health. So therefore, my purpose today is to first share this aforementioned impact of a nutrition-sensitive intervention on women's risk of depression, to then unpack this pathway, and finally to end by giving recommendations to you all to measure depression in agriculture and nutrition interventions. So the Singida Nutrition and Agroecology Project, SNAP-TZ, was the project that we did this impact evaluation with. It took place from January 2016 to 2019 and is a participatory agroecological intervention and nutrition sensitive. And so the project used integrated lessons on agriculture, nutrition, and gender equity in workshops with farmers, and did so by using storytelling and singing songs to really emphasize participation. Additionally, an elected village member from each village would hold monthly participant meetings and give household visits to check on the participants and see how their agricultural practices were changing and if they were acquiring knowledge. And finally, legume seeds were also distributed to participating households. And so This took place in 20 villages, and 10 of them were randomly assigned to receive these interventions, while an additional 10 were assigned to be the control or delayed intervention villages. And the expected outcomes from those receiving these workshops were to see increased sustainable agriculture, increased food security, increased gender equity, and increased nutrition knowledge. And as you might have noticed, an impact on women's depression was not one of the primary outcomes. And to reiterate, that was my main goal, to see how this nutrition-sensitive and agroecology project impacted women's depression. And specifically, we measured women's risk of depression using the Center for Epidemiological Studies depression scale, called CESD. And this is a way of measuring depression in a non-clinical way, and you look at depressive symptoms over the past week through 20 questions. And we use the East African cutoff score of 17 or higher. It's a scale from 0 to 60, but a 17 or higher to denote that a woman was at risk of depression. And what's really great about this scale is that you can use it as a continuous variable as well as a categorical variable with this cutoff. And we used both in our analyses. And so now on to the results. Our first analysis was looking at how the proportion of women at risk of depression changed over time. And as you can see on the x-axis are the years at which we conducted annual surveys, which included questions on CESD. And the purple line right there denotes when the interventions began. And so at baseline, women within both groups were at a similar starting point at around 41% of women being at risk of depression. And this is a big deal because that means almost half the population that we were studying was at risk of depression. And then, over time, you can see that women within the intervention group had a smaller proportion of women at risk of depression. And then the second analysis we did was looking at how the average CESD score changed over time. And again, both groups started at a similar point at baseline, and this happens to be that magical 17 number, so many were at risk of depression. But then over time, again, you can see that women within the intervention group were at a consistently lower average depression score. And from difference in difference analysis, we saw that it was 11 additional percentage point decrease from the control group. And I just want to emphasize that these two results that we saw, the impact on depression, were really surprising because, again, depression was not a primary outcome for the project. And so then the next question is, why did this impact on depression happen? And to answer it, I ran a mediation pathway analysis and found that it was changes in food security that accounted for 22% of the changes seen in women's depression scores. And as I had mentioned earlier, food security already was in the conversation of affecting mental health, so this pathway makes sense. And as a disclaimer, I mainly was focused on seeing what role food security played in this pathway, but of course there could be other potential mediators within the pathway. And that's why that's my future direction, to see what other possible links there are. And current literature out there says that gender equity and social support could be things that affect mental health and women's depression, as well as the participatory aspect of SNAP-TZ being something that could also be a part of this pathway. And because this is all such new data, my recommendation to you all is to measure women's depression within your studies and see if there's also an impact besides this one study. As well, because we don't know specifically why this or why this impact is occurring, it also would be a good idea to measure potential mediators within the pathway to really see what's going on. And so then, what are the major takeaways? The big one is that this is one of the first reported impacts on decreasing risk of depression for a nutrition and agriculture intervention. And this impact seemed to operate through changes in food security. And then finally, the most applicable takeaway from these findings is that these interventions have the ability to reduce the loss of quality life years for women in farming communities. And this is especially important because although there are known and effective treatments of depression out there, less than 50% of those affected by depressive disorders have any access to this treatment at all. So, agriculture and nutrition interventions could serve as an accessible method for reducing depressive symptoms. So thank you.